Just for those of you who do not know me or have not ever met me, my name is Keita Cole. I am the nutrition director for the new Department of Disability and Aging. We were the Tennessee Commission on Aging and Disability. We've merged with the Department of Intellectual and Developmental Disabilities. Now we're the Department of Disability and Aging. It's a mouthful. But I'm the nutrition director, and I'm also, oh, David, with that Alabama, I can't.
My eyes.
That's why I was waiting.
That's why you were waiting. You wanted to catch me off guard. I appreciate that.
My eyes are burning. They're burning.
Anyways, I'm the nutrition director. I'm also the dementia service coordinator. Thank you all for being part of our advisory council. I'm just going to kind of let you all introduce yourselves, kind of what your background is, and we'll start with Lynn because you're the next one up on my screen.
Good morning, everyone. I'm Lynn Drew, and I'm here at the Upper Cumberland Area Agency on Aging and Disability. I know that's a mouthful also. I currently work as the Family Caregiver Coordinator here. And previously, I worked with Amanda at Alzheimer's Tennessee. And so I'm happy to be here today.
Okay. Thank you, Lynn. We're happy to have you as well. Elaine, do you want to go?
My name is Elaine Cole. If you recognize the end name, she's my daughter. I'm a financial advisor, been in the business for about 35 years, and I think I am here to help with advice on giving paperwork and stuff for the end times, or what the elderly might need is setting up to pass on things to their beneficiaries or whatnot. So good to be with a group.
Thank you. And it's weird to say Elaine. Yeah, it's Mama. She got voluntold to be part of the group, so she didn't get a chance to volunteer like everybody else. Amanda, you want to go next?
Hey, well, good morning. My name is Amanda Leach, and I am the West Tennessee Regional Director for Alzheimer's Tennessee. I have about 21 years under my belt of aging services, and 19 of those is with Alzheimer's Tennessee and that Alzheimer's community. So really excited to be a part of this new initiative, which we know Alzheimer's care and caregiver support is not new. But we're just excited to be a part of this. So Elaine, it's good to see you. I think the last time I saw you was in a hayfield taking pictures. So it's good to see you this morning.
My poor mom gets wrapped into everything.
And everything, so I stick my nose in her business all the time.
And that's okay. That's what mamas do well.
All right, Miss Tanya.
Hi, everybody. I'm Tanya Reynolds. I live in Thompson Station in Williamson County, and I'm a caregiver for my husband who has early young onset Alzheimer's, and he's 58 years old. So
thank you so much for joining us. It's going to be so important to get your perspective, that caregiver perspective. So we're excited to have you part of the group. Mr. David, even though you're wearing that Alabama shirt, I guess I'll go to you next.
Hi, good morning, y'all. I'm David Taylor. I'm the State Director of Nursing for DDA. And Tanya, I feel for you. It's hard to care for somebody 24 hours a day. And my mother had dementia and was in assisted living for 9 years. So I was thankful that we were able to keep her there because I rehabbed her for 6 weeks at home one time, and she got into everything. It was really challenging. But anyway, I've been a nurse for 39 years. I worked 20 years in the hospital as an operating room nurse. And then I learned about the ADD and worked in the East region as a regional nurse for 14 years. And I've been here at Central Office for 5 years as the Director of Nursing. So I'm really, this is the thing that's dear to my heart. And but also in the population that we have specifically served in the past with the IDD population, there is a higher incident of dementia, and now with the aging population we serve, that's going to be one of the big things So really, really glad to be able to participate in this.
Thank you, Mr. David, and I won't
Thank
hold it
you.
against you with that Alabama stuff on. But I am going to give you a hard time about it because that's what I do. Jackie, you want to go next?
Yes, I am Jackie Moment. I'm the Dementia Program Manager, working on the KETA for the ADPI grant. And I used to work in the mental health field for about 5 years as a care manager. Basically, work with people with different mental health disorders, Alzheimer's being one of them. Working close with them, alongside them. Yeah, and I'm excited to have y'all here. Thank y'all so much for being a part of this.
Thank you, Jackie. Mr. Bruce?
Yeah, I'm Bruce Davis. I'm Deputy Commissioner of Clinical Services for DDA. I'll tell you, I've been working on David on that Alabama stuff for many, many years. I haven't ever persuaded him to come over to our side of things, but in any case, he is a great director of nursing. I'm glad to have him. And I'm glad to be connected with all of you. I've been working in this field for about 36 years. My background is licensed professional counselor, senior psych examiner. And so I'm very interested in trying to help people with aging issues and trying to learn more about them, as well as support in any way that we can. So that's what we're trying to accomplish. Appreciate you having us on the advisory council.
No problem. Thank you for being here. And last but certainly not least, Miss Kathy.
Good morning, everyone. And David, you do have an ally here. Roll Tide. I just don't have on my shirt today, so you don't have to move over to the other side. You know, we know how to take the hate, right, David? Right. I'm Dr. Kathy Scott. I am social work professor at the University of Tennessee in Chattanooga, and I'm working on the Roadmap Grant Initiative that we are working on. It's a collaborative grant with the Department of Nursing, Social Work, Public Health, Occupational Therapy. And then I've also been a part of an Engaged Community Initiative to work and make this Chattanooga and surrounding areas more dementia friendly. My background, I've worked many years with older adults through a waiver program when I was living in Alabama. And then I worked many years at the Alexian Brothers, when it was Alexian Brothers, the PACE program. And through my social work education, you know, getting students you know, exposed to a lot of aging issues. I'm excited to be a part of this initiative. And, you know, it's just exciting to see the statewide initiatives to address this issue of dementia within the aging community. So I'm excited to be a part of this council.
Thank you so much, Miss Dr. Kathy. We're excited to have you on here as well. So just, you can all see we come from a very diverse background. My background, I started in the nursing home field. I was admissions and marketing for skilled nursing facilities. I was a hospital liaison, then I transitioned and started a volunteer transportation program in West Tennessee to make sure older adults could get to where they needed to go. And then it'll be 3 years in November, which is crazy for me to think, that I have lived in Nashville and have worked at the state unit on aging. So I started at the bottom and have worked my way up. So we definitely all have a diverse background, and that's why I'm thankful you all are part of this advisory council. Just to give you a little update on what we're doing. So this is the Alzheimer's Disease Program Initiative, or in state government, we like to abbreviate, so ADPI. This grant is a grant that I wrote back in the spring of 22, maybe 23, I don't know, it's been so long ago. But so we received the grant in September of 23. So I guess I wrote it in spring of 23. It is a 3-year grant, and the main goal of the grant is to make Tennessee a more dementia capable and dementia friendly state. One of the big things that we are going to do within this grant is we're going to implement what we're calling dementia navigators. So Miss Lynn is going to be one of our navigators. She's going to be our guinea pig in the Upper Cumberland region. We're going to kind of learn from her, and then we're going to take whatever we figure out with her and duplicate it, hopefully, and with the West Tennessee region as well. Jackie is going to serve as our navigator and me in the Middle Tennessee region. And what these navigators are going to do, they're going to be community level workers. They are going to be kind of a frontline connection for families who either suspect that there is a diagnosis, they actually have a diagnosis. There's not a requirement that they have to have an official diagnosis to receive our services, because we know how hard that is to get those official diagnoses. So we want to make sure that those resources are available regardless if the doctors have seen the notice or not. The family members, you caregivers, are the ones that are going to notice it before anybody else. These navigators are going to kind of handhold a family from beginning to end. They're going to assess them. We are working in conjunction with the Department of Health because they also have received a grant to do navigators. So all of the training and materials that we're developing are going to be co-branded with us and the Department of Health, because families don't care where the person works. They just want the resources. They need the help. So we didn't see any point in us making things more complicated and more difficult. So what we're going to be doing is we have started what we're calling a memory lane guide, and it's going to have different pathways. So you can kind of see my marketing background coming in. It's a memory lane. We've got pathways. But we're going to have these resources for people depending on where they're at in their journey. If it's a brand new diagnosis or suspicion of a diagnosis, we're going to start off with where do we need, what's our first step? What do we need to do? We do have somebody, a lawyer that's going to be on here. She couldn't be on today, but she will be on future calls, so she can give us some legal advice on different things. We have my mom as the financial planner, so she can advise on financial planning, kind of what paperworks, what things do we need to have in order, so we can do this checklist and we can have this stuff available for these caregivers so they don't feel lost and they don't feel like they're just out there floundering. Miss Tanya is super vital and important in this because she is a caregiver. She is in the middle of it. We definitely want your perspective. We want to know, what do you wish you had? What do you wish you need? What are things that you're struggling with? So we want to make sure that we're tapping into all of these resources. So caregivers like yourself, or as Jackie and I coined it with another group that we met with on Tuesday, share givers instead of a caregiver. We're calling them a share giver, because we're sharing responsibilities with everybody. So we want to make sure these share givers have what they need. And again, we're going to be doing a lot of training. Jackie just recently completed his dementia capable care certification. It's through the Crisis Prevention Institute, and he is also a certified instructor. So he gets to train me now. I'm going to be his worst pupil, but me and Lynn, we're his guinea pigs. But this training is going to be one that we're going to offer it to anybody that wants to get certified in dementia capable care. Obviously those that work within the community and work with family members and caregivers and care receivers, but also anybody just in the general population. We're also going to be doing dementia education and brain health education. So those were the two PowerPoints that I sent you all beforehand. Feel free to read through them. If you have feedback or changes that we might need to make, again, y'all are experts. Y'all know what you're doing. Jackie and I just research and put things together. But we want your feedback. So especially Amanda and Lynn, with y'all's experience with Alzheimer's, if you look over those and you're like, this is not clear, this is not right, this is not accurate, we want to make sure what we're putting out there is correct information. The memory lane information, we're still putting it together. You will all be getting that so you can read through that. So on the financial part, if there's things that we're missing or we haven't thought about, the caregiver aspects, the clinical aspects, kind of any of it, we want all your feedback. And we just want y'all to help us get the word out. We're going to be doing what we're also calling dementia gatekeepers. So we're going to be working with businesses and communities to train them on signs and things to recognize with dementia, with the goal of a business completely getting all of their staff trained. So like a bank or a church or a grocery store, and then they can display something on their door that says they're a dementia friendly business. So those that are in the community that have dementia are their share givers that are helping them through this process, can feel accepted, can feel like they don't have to be stuck at home. They don't have to be secluded at home. You know, we want people to be in the community. We want them to live in the community. We want them to thrive in their communities. We don't want them to feel like that they have to be ashamed. We want to break down those barriers and reduce that stigma and reduce that caregiver burnout and caregiver fatigue. So that's a lot of what we're doing. It's a lot of little pieces. You all are going to be vital to it because you are going to advise us on what we're doing. We'll update you all on how many trainings we've done and how those are doing. We're working with UT, got to get that in there. So they're doing our evaluation. Sorry, David. Um, they're our third-party evaluator. And so all of our trainings and all of that will be sent to them, de-identified. They're going to evaluate it. They're going to read all the data, do all that fun stuff that they do that I don't know how to do or don't want to do. And we'll send us back that data analysis and if we need to adjust anything. So I've put a lot out there. Does anybody have any questions, concerns, ideas? Amanda, I see your wheels turning in your head.
Well, it's still early in this process, but I do. I mean, I think that what we are seeing across the board, unfortunately, comes down from the state of funding, you know, with additional caregiver funding support because not everybody can pay private pay, right? Not everybody has access to adult daycares. Not everybody has access to or qualifies for a part of the state that has dementia caregiver grants. You know, our AAADs have some dementia funding for caregivers that you get 4 hours a week. I don't know how long that lasts, I guess, till the grant runs out. But I think just making, I know with Alzheimer's Tennessee, and Lynn can attest to this just with her time with us as well, you know, we just want to be at the table. We want to make sure that we are providing support. And I'm not saying Alzheimer's Tennessee, I'm just saying the Alzheimer's community. I feel like families, what we hear every day is it's a breath of fresh air when you get to someone that knows. I had a lady that came all the way from Memphis last week. She got the diagnosis 6 months ago, as a lot of our people here. Here is your prescription. Let's start out with Aricept, Namenda, whatever the doctor feels. Come back and see me 6 months. Well, a lot of things happen at home. You know that you know, Tanya, I can just see and understand what happens 24/7. You know, there's a lot that happens between the next doctor's appointment. So I think I love the word navigator. I feel like I sit at the table a lot and we're the sounding board for families, and just someone to answer the questions, someone to spend the time, someone to have a piece of paper or a resource or a direction to go. I'm just excited. You know, we don't have the magic pill. Unfortunately, we don't have that pill that's going to cure that. We're getting there. We're getting there. We know what causes it and we know what slows it down, but we haven't got there yet. But I think just being accessible, I think that's the biggest thing, is for people to communicate so people knows that this program is there or whatever across the state is there, as well as resources.
Yes. And the ultimate goal with this, I mean, obviously we got a great grant from the federal government, but it's like you said, Amanda, it's never enough. You never have enough funding. Yeah. I would love to have a navigator in all 95 counties in Tennessee. That's my ultimate goal. Is that going to happen anytime soon? Probably not. But we're going to take all of this information that we're gathering, all of this data, all of this feedback from you all, feedback from the community, feedback from those caregivers that we're working with. And then I can put this in a proposal and I can go to the General Assembly and say, look, we had this much money. We had these few navigators. This is what we were able to do. Imagine what we could do across the state, because the statistic that everybody likes to talk about is the state of aging in Tennessee. And by 2030, 60 plus is going to outnumber 18 and under for the first time ever. So aging is not going anywhere. And I've got a little thing hanging on my thing. It says aging is so cool. Everybody's doing it. So, and I love that. You know, we need to embrace it. We're all aging. From the day we're born, we're aging. And like Amanda said, you know, you get that diagnosis and you're just kind of like, now what's next? Because a lot can change. And what I would like to see is, for the longest, cancer was such a scary word. Not that it's still not, but used to, when somebody, you know, got a cancer diagnosis, you didn't talk about it. Now you hear a cancer diagnosis, you're like, what type do you have? What can I help you do? And there's like a game plan. I want us to be that way with dementia. I don't want it to be, oh, I have a diagnosis of Alzheimer's and it's like, oh, I'm sorry. And then you run away from it because you're scared and you don't know how to respond. Or I have early onset Alzheimer's, or I have frontal temporal lobe dementia, whatever that might be. I want the community, I want the churches, I want banks to be like, okay, here's our game plan. This is what we're going to do. How can we help? So then that conversation around dementia doesn't become, oh, I'm sorry, and let's run away from it. We embrace it and we talk about it like we talk about cancer, like we talk about other things that are going on, high blood pressure, diabetes, and things like that. So I think this whole education part of it, so those 2 trainings that, we sent you all, those are huge. Those are going to be those are going to be for anybody anybody that wants it, volunteers, church members, any kind of community that wants that training. We're going to be offering that. We are working on, thanks to Mr. Bruce and Mr. David's advice, we are working on a training for dementia in the IDD community. I'm still working on finalizing that, but I will send that out once I get that. It is a little bit different. There are some different things that we have to look at with the intellectual and developmental disability communities. But the need is still there for those caregivers to have that support. So that's what we're working on. That's what we're trying to do. We are always open to suggestions. We are open to feedback. Anything that you want. I told him eventually I'll shut up and quit talking about it and let him talk about it because it is eventually going to be his. But it lived in my head for so long, it's hard for me to let it go. So, but Jackie will be your main point of contact for most everything. Like I said, Lynn is going to be our navigator in the Upper Cumberland region. We're getting contracts finalized. Hopefully we will start getting everything going September 1st. The grant is a 3-year grant. Yes, I'm at the end of year 1 and we haven't been able to do hardly anything because of red tape with the government, but it does have a 1-year no cost extension. So we still have 3 full years to get it out there and get it done. And I'm excited about it. So any other comments, questions, concerns?
Just to give you an experience that I had yesterday, I was working in the city of Germantown yesterday, and one of the human resources ladies came in to me and she said, we have an employee that's having a situation with her parents and she has no idea where to turn or where to get any assistance or anything. And so that made me think that how important it is for employers and companies and even banks and things like that to at least know, well, here's a list of resources that you can give your client. You don't have to know about dementia and you don't have to know about all that stuff, but you have that list of resource to give your employee to go see if any of these people can help where you need help. And so I just thought, well, wow, this is very timely that this came to me and I was able to give a little information, but of course I just cover a small range of things. So this is very, very much needed, I think, across the state. And I'm very proud of my daughter and of you, Jackie. This is great. So
Thank you so much.
I'm excited that something's coming to pass with this.
Yes.
Yeah, and
Yeah,
Jackie's, oh, I'm sorry, Tanya, I didn't mean to interrupt you, but Jackie's working on a resource library, like a resource guide. So he's trying to gather a lot of different resources statewide, not just in Middle Tennessee, not just in East Tennessee. Obviously, there's so many out there. Am I going to tell you it's 100% comprehensive? No. That will be something that you all will eventually get as well to look through. And if we've missed something or if you know of one that we don't have on there, we want to add it. It's going to be a living document that hopefully we'll get on our website soon so we can start directing people to it. So when you do have situations like that, where you're just like, I don't even know where to turn. That's at least a starting point for somebody. So we, our partnership with Alzheimer's Tennessee, Alzheimer's Association, they're also going to be involved in this council. They weren't able to be on here as well. So, we're spreading the love to everybody. But we just want to make sure it's there. So Tanya, I'm sorry, is it Tanya?
it's Tanya. Yeah.
Okay. So
It's spelled with an A, but it's pronounced. Yeah.
I have a cousin named Tanya, so it's going to be hard for me, but I promise I'll do better.
It's okay. I answered all of the versions, right? So, I'm excited to see this come to fruition because, it's tough to find support. And I'm on calls with the Alzheimer's Tennessee hosts for caregivers. And there's like a diversity because we're all in different parts of the state, and what's available in one area is not available in the other. And it's, so it's very hard to sort of navigate and figure out, oh, you guys got that. Do we have that here? Oh, well, we don't. What else do we have, right? And finding people who know.
Yeah.
Yeah. And doctors absolutely do not help once they give a diagnosis. They're like, just message us when you need a refill, and that's pretty much it.
And that's sad. That's something that we hear, Tanya, every day. It's like we get the diagnosis, we walk out the door, and that's kind of stops. And unfortunately, I'm not going to just sing Alzheimer's Tennessee's praises just because I've worked with them for 20 years. I mean, I am, but I'm not. I mean, I've got to be diplomatic, right? But anyway, I just know what we do. And I know that we try to meet people where they are. I'm actually in Parsons today working from home in Decatur County, fixing to go to McDonald's and meet a lady because she is the caregiver for her sister and they have no clue what they're doing. So meeting it, Lynn's heard the story. I know Keita's heard the story. I mean, walking the aisles of Kroger, I've done it multiple times. So I'm sitting at McDonald's today. And so it's got to be there. So Tanya, I know that you're connected with Cheryl, and I know that there's so many avenues across the state that have different parts, but I wish there was I know we work really hard for a toolkit. It's kind of like that one-stop shop, but like you said, every division of the state is so different. I wish that we had adult daycares like Howard Circle of Friends in Knoxville or memory cafes for individuals with early onset. It's not got to West Tennessee yet. West Tennessee, it's very foreign. It's still, I kind of chuckle and say it's not even really funny, but we're probably 20 years behind in the medical community in the west part of the state. I mean, it is so foreign, some of these things. And so they kind of look at me sometimes with three eyes when I talk about things. And I'm like, ooh, we've done that for 20 years. And so that's what I hope, Keita, is that even if we have one piece of paper that can be consistent across the state, if that's a number to a resource to a community, I'm praying and hoping that's what we get. And I feel like there's agencies that do it well, but we all can't do every part of it.
Yeah. And that's what we're hoping this memory lane guide will be. It's broken down by, like, if you have chronic disease questions, if you have medication questions, if you have that, and it's not specifically pointing to one agency. It's like, this is the things that you need. This is like your checklist, and it's a literal checklist. There's like a box out beside it. You can check it off. So regardless of where you are in the state, and we'll try to help connect you obviously to those resources that are there, because we're going to have information in there as well about those. But it tells you, like, okay, I need to find a caregiver support group. I need to find, a bank that's dementia friendly. I need to find a financial planner that can help me determine what all I need to get in line before my loved one, gets to a point where they can't make those decisions. So it's those types of things. Again, it's not going to be specific to, this is what's in East Tennessee, this is what's in West Tennessee. We do have our resource guide broken down that way. It is broken down by county, actually, but it's just in general a kind of information across the board. And like I said, health is going to have some navigators that they're hiring as well. The navigators with us and with health are all going to be trained the same. The toolkit's going to be the same. The memory guideline's going to be the same. So regardless of where they come in contact with a navigator, they're going to get the same information. And obviously we'll distribute that out to you all as well. And if you come across anybody, Mom, if you have another client like that, you at least have some kind of starting point for them. Again, it doesn't necessarily have to be dementia. Obviously, we're heavily focused on dementia, but we do have some information in there just about chronic disease management, healthy aging, healthy brain, how to just live. Like I said, aging's so cool. We're all doing it, but we want to age well. So there's that information as well. Mr. Bruce, Mr. David, do y'all have anything from the IDD world that you want to include in here?
No, I think y'all are covering stuff really well.
Yeah, I mean, this is, I won't say it's a new area for us, but it's certainly an area we have not emphasized enough, I think. And, especially in our population, one of the key things is that a lot of times people don't recognize dementia because it's sort of conflated within the diagnosis of intellectual or developmental disability that they have, particularly intellectual disability. And but it can still have a tremendous impact on the caregivers of people with intellectual disability because they begin to have to provide more care than they've had to provide in the past. And so there's a lot of support necessary for this group as well. But I don't want to just be, you know, promoting ID concerns here. We're all part of the same unit now, so we're joining in also with your efforts for people who are in the typical range of intellectual functioning who are experiencing this as well. So we're fully on board with that, and I love a lot of the comments that have been made so far.
Yeah, and we definitely want your input on everything. It's just that you have that experience in the IDD world that I don't.
Understood. Yes,
And that's like when y'all brought that up to us before about, hey, do you have a training on IDD? Then I was like, I hadn't thought about it, but with the merger of the department, I'm like, I probably should have, but that's just not. I've always focused on aging. I haven't shifted that focus, and it doesn't matter if they're aging or if they're not. We have the early onset as well, so it's just that shift and getting the information out there regardless.
You bet.
Yeah.
Look, this is all part of the growing pains of merging is us trying to figure these pieces out.
Yeah, Dr. Scott?
Yes, I just wanted to say, I appreciate everyone's, perspective and what we have to offer. And I think having worked with families that really have a misconception about what dementia is, I can't tell you the number of times I've heard people say, oh, she just has a little bit of memory loss. It's not dementia, and I think, efforts like this to really educate on what dementia is, and them having, families and loved ones having an understanding of the disease process early on so that they can prepare themselves and get the resources that they need. And also, I'm excited to hear about this initiative, to really delve into the memory loss and dementia and IDD. I am a caregiver of my older sister who has intellectual disabilities. And as she is growing older, I'm recognizing, I've worked in, with older adults and people who are aged, but this idea of the trajectory on aging for someone who is, has lived with intellectual disabilities, that's a phenomenon that I'm not familiar with. So I'm excited about that. And, she is a part of a wonderful program and community, here in Chattanooga. But I think it's just more and more education is needed in that area. So I too am excited about all of that.
Yeah, and I'm excited to have you on board, Dr. Scott. Getting younger people interested in what I say, the aging population. It's not a sexy disease. It's not a sexy thing that a lot of people want to go into. So with you being a social work professor and, us being able to tap into those students at that early age to show them, hey, again, aging, we're all doing it. It's so cool. We're all doing it. So let's get behind it because we hear so much, and I've heard Amanda talk about it, with the different things that we've done, that just the shortage of gerontologists in the state and exposure to aging and IDD and, anything related to dementia. A lot of our doctors nowadays, like Tanya said, they give you the diagnosis, they say, here's your prescription, and they leave because they don't even get training in med school, maybe a semester, if that. So the more education we can get out there, the more comfortable we can get people with talking about dementia, talking about memory loss. And again, it doesn't have to be a bad thing. It's part of it's who we are. The person that is living with this diagnosis, they're still the same person. They just communicate differently. So we just have to figure out how to communicate with them in the way that they see fit. So I'm really excited about it. As you all can tell, I'm definitely passionate about this. This is something that I love. So
yeah. And you mentioned students, and they're normally when we have students come into our program, I'll do a poll. What is your area of interest? And a lot of times it's I want to work with children. I want to work with children. And out of, I would say 5 to 10% of the students in our program, have an interest in working in aging or with older adults. And what I stress to all of my students is, you may want to work with children, but even in your work with children, you're going to work with a grandparent who is the sole caregiver for their children, or you're going to work with a parent who's in that sandwich generation, caring for an older adult and caring for a child. So educating, having the education and foundation of what aging looks like and some of the issues that are associated with aging, and even what it takes to, for successful aging, how to engage with seniors or older adults. It's going to be very important. So, we do that. And there are a lot of departments on campus. We work a lot with nursing and public health. And we're hoping, it's a goal of ours, is just to have an interprofessional center, that focuses on, aging. Because, having worked at a PACE program, I saw and I experienced the beauty of everybody at the table: the nurse, the social worker, the doctor, the chaplain, the nutritionist, the occupational and physical therapist, coming together and working together, pooling, education ideas and interventions. And just to see what it does for an individual and the family is just remarkable.
Yeah.
Dr. Scott, I will echo that too. I had a conversation this week with the Heirs Foundation, and one of the things that we're looking at doing is going in and continuing to train our nursing students and our young social worker students too, because I feel, and you quote me if I'm wrong, Dr. Scott, when you graduate from the nursing program, probably 70 to 85%, you're going into a hospital, a nursing home, home health, some form. You do not get that 9 to 5 clinic. And, yes, you may be a nurse that's going to do pediatrics. That's fine. There's like a little percentage, I think, of specialty, right? But most of the time you're going to be in the hospital, the ER, the nursing facility. All of that. And so we've got to make sure we're more than just a definition. You just, what is dementia and what is Alzheimer's? Well, there's a whole heck of a lot more than geriatrics than just that definition. And I know Lynn and I have tag teamed before with the TCAD programs and going in and training those LPN students even before they go, and bringing the virtual dementia tour, which is the hands-on of what this looks like. Education is power. You cannot have too much in your toolbox. And I'm just excited, Keita. I can feel your excitement, like I have it too. And I think everybody in this group is so honored to be a part of it. And so I'm ready to hit the ground running and do what we can. I will say there's a piece of information that I don't mind at all to share to you, what's normal and what's not normal in the disease, like as we age, because I think sometimes people say, oh, well, I'm old, I should be forgetful. Well, no, that's not really necessarily true. My grandmother was 95 when she passed away, and she was sharp as a tack. That's not affects everybody. So what's normal as we age and what's not normal might be something to add to that toolbox too.
Yeah, absolutely. And that's what we want. Anything that y'all come across, if, you have resources that you think might be beneficial from the financial aspect, from a caregiver aspect, if you're like, this is something that has helped me, this is something that I, have realized that I didn't know I needed this much. Like that's what y'all are here to advise us. You're here to give us those tools. We want to make sure that as we're reaching out to these other folks and we're building those care plans and we're building that information on, okay, here's your next steps. Here's what we need to look at. Here's questions you need to take to your doctor. Do you actually have a diagnosis of dementia, or is it just a mild cognitive? Is it just dementia? Is it Alzheimer's? Is it Lewy bodies? Like, what is it? And a lot of people don't understand that dementia and Alzheimer's are not the same. They're related, but there's like 200 types of dementia. Is that right, Amanda?
Well, over 120. But look at
Okay.
this too. I mean, you can throw that out because depression mirrors it a lot. I mean, what if you're dealing with mental health and, depression and all this other stuff, and you really don't have a diagnosis of dementia? I
Yeah.
mean, there's so many things that can go behind. So I always tell people, be proactive and go to your physician. Make sure it's no deficiencies in vitamins and all this other stuff that could be going on internally. Don't label yourself until you know.
Yeah, for sure. And that's
I-
what we want people to understand. I'm sorry, Mr. Bruce.
No, I didn't want to interrupt you.
No, go ahead.
I was just going to say, I noticed several parallels though between our missions, because the Kathy's emphasis on interdisciplinary work, I think, is such a important part of all of this. There's really not one profession that can cover all of this, and I think we reflect that in the composition of our central office clinical services department, that it's an interdisciplinary approach. So when we look at a situation, we really know that we're all kind of we're very conscious of what our own discipline addresses, but not necessarily what all the other people are seeing that are on the team. And I've heard it likened to, say, when you've got blindfolded people holding a different part of an elephant, that they're going to describe the elephant differently. And in this circumstance, you have to be able to talk to one another and communicate to be able to get a holistic picture. And I do think the caregiver or the sharegiver, I'll adapt to that language, is an important aspect of that as well, because they know the person better than anyone else. And so all of those themes, I think, are quite important. And so I think this is a really important project that and I think that should continue to be a theme as we continue to approach this.
And one of the things that, just thinking about risk and things like that affect everyone is the aging population, the IDD population, and even the caregiver population as they age, is a fall risk. And you have a person fall, and it can really complicate healthcare and their ability to, if they're a caregiver, their ability to care. So that's a big thing.
Yeah, and those are some of the things, we want to, again, like I said, we're focusing in on dementia, obviously, because we want to get those resources out there, and because the federal government said that's what this grant was about. But within that, we are including in there those, healthy aging, those fall prevention, check your medications, making sure that they're not interacting. Maybe it's a medication interaction. There's not even really like a mild cognitive impairment or dementia. It's a medication interaction. And because they've seen so many different specialists, it's like, okay, this is the problem. It's not really, like Amanda said, don't label yourself that I have dementia until you know all the facts. And so those are some of the things that, those questions that we're putting in there. Get a copy of your records, have that information handy, know what you're taking. We've put in there notes about, watching behaviors, noticing when behaviors happen. Is it happening in the morning? What's happening? What's in the environment around it? Is it something that's consistent? So we can try to address those things to try to work to relieve that burden and that stress from the caregiver. So it's going to be ever developing. We're going to start with this memory lane guide, and I feel like maybe 3-6 months into it, we're going to have way more added to it than we ever anticipated, but that's okay. If that can be that toolkit for that family and that caregiver to go to, and they say, okay, here's my checklist, here's what I need, here's my notes. We're going to give them actual binders with all the papers in it. Like, it's not going to be digital, it's going to be an actual binder. We want them to have those tangible things so they can refer to it. We're going to do some interventions with the caregivers or sharegivers. It's called Star Caregiver. And it's a 6-week process where we're giving them tips and tricks on how to address adverse behaviors and change the environment or change what's happening. Instead of using medication, let's look at what we can do holistically to alter those behaviors so we can try to help remedy the situation and break down some of that frustration and agitation and different things. And again, that's even common in the IDD community. There's that whatever is happening, that's a communication. Any kind of behavior is a communication. They're trying to communicate that something's not right. And it's just, we've got to figure out what that communication is.
And I think you need to also include nutrition in this, because, there are foods that we as elderly, we don't always eat properly. They just come in and have a cheese and cracker. But if you're caring for somebody like that's got dementia, they need good nutrition. They need to eat well, and that helps. You got to feed the brain, and it can help. I think I've heard this said before. It can replenish itself if if you're feeding it correctly and doing the things that you need to do. So,
Miss Elaine, was you with me yesterday? We talked about that same thing at Hardin County Senior Center about making sure that you're eating well with the MIND diet, and you Google that. The MIND diet is great, and then hydration. We're not thinking about hydration. Oh my word. And sleep. Oh my gosh. If your brain is not clean, your brain only gets clean when you sleep and you exercise. So if we're not doing all of this, right? And so, which is a huge thing, but I know keto, I know there's a part that we're probably in there too. And I love the checklist idea. To me, that's simple. When I feel like I'm marking things off a list, that's simple to me. But I was going to also think power of attorney, legal and financial, because that's a huge deal. Medical and all that kind of stuff. I know Elaine knows that with all that financial stuff, but if you don't have those power of attorneys and medical and financial in place, sometimes you run up against a wall and can't make some of the right decisions that you need to make.
Yeah.
Those are some things that have to be done before the mind gets bad too, because if you feel like you're heading in that direction, those power of attorneys documents have to be done while they can clearly make those decisions. So that's once you get a diagnosis, that's probably one of the first things you need to be looking at. Whether you put it in place or not doesn't matter. It just has to be in place.
Well, and I agree with the reason they do it so soon too, because a doctor it takes a lot for a physician to prove somebody incompetent, and so to make sure that we've got that in place I feel like it's the golden ticket. You need to have that before health declines. So.
Yeah. And I'm sorry, Leanne, go ahead.
That's okay. One of the other things working with their doctor is to fill out that post form with the doctor. That way, as early on, that way they know that their wishes are carried out.
Yeah, and we've got those sections in there about living will and about the post. And like I said, we have a legal person that's going to be on here, so she just couldn't make it today's meeting. So we will have that advice from a true lawyer. I am not a lawyer, and I do not play one on TV. So I just wanted to make sure that we have that advice. So.
Keita, I think it's very important to have, legal insight. Being a caregiver for my sister, her program had
I think you froze, Miss Kathy. We might have lost her for a second. I know she's out and about. So, but yeah, we're gonna have all of those little sections in there. And like I said, once you see them, if we're forgetting something, because I'm not an expert, and I'm not a caregiver for someone who has been with dementia. Yeah, Miss Tanya, you're right. The path is different for those younger than 65. And we want that information out there as well, because we are seeing more of that. I said, it's sad that it took a celebrity like Bruce Willis to get a diagnosis of that frontal temporal lobe for people to even start paying attention to it. But if that's what it took for us to start thinking about it and start talking about it earlier, then that's what it took. So yeah, definitely want to it's not just those that are aging. It is anybody can get it, big Tennessee fan here. Everybody knows the story of Pat Summitt, and that she was active, she was a coach, and then she still got it. So nobody's exempt from it. So just making sure that these caregivers have this information and don't feel like they're being a burden to somebody else to reach out and ask for help. That's what we want these navigators to be there for. We want them to be your hand holder. people, organizations like Alzheimer's Tennessee and Alzheimer's Association do great jobs at it, but there's only so many of y'all, and we know that there's so many people in Tennessee. So, we're not trying to say that we're better than Alzheimer's Tennessee or Alzheimer's Association. We're just trying to be a supplemental help to them, and to use that expertise and just get those out there more. So, we're almost done. I'll give you a little bit of time back unless somebody else has something else they want to add, but thank you all so much for being part of this group. Those PowerPoints that I sent you, feel free to read over them. If you have any additions or changes, send them my way. Send them to me and Jackie. You have both of our emails. We're happy to make those adjustments and make those changes, because again, we want this to be the best that we can get out there. So we want y'all's feedback and y'all's information. And as we get other things developed, I'll be sending them out. I'll try not to spam you a ton. But we definitely want your feedback, and we'll try to, I don't want to bombard you all with a lot of different meetings and different things, but we definitely want to try to meet up as often as we can to get that feedback and just hear from y'all and hear how we're doing and where we need to go from that. So Jackie, you got anything you want to add?
Yeah, just wanted to reiterate how much we appreciate you all being a part of this and taking the time to do it, because it's very important to what we're trying to do. So I just wanted to reiterate that to y'all.
Quick question, Keita, on I have another ADPI meeting on my calendar at 1:00 today, and I'm not sure if that was valid or if there was.
It's not with me if you have it.
Okay, well, but it would be with you, wouldn't it? If
Yes, sir.
if
It
were
should be, or
accurate.
Jackie
So
won. So
I
it
don't
might
know
have
what
Yeah.
may have
Me either.
happened there, but I just wanted to check and make sure that I wasn't going to miss something if it wasn't there this afternoon.
No, sir. You're good. You're good.
Okay, thank you.
Well, thank you all so much. Let me stop the recording before I forget it. Okay. So